Is that when the Saints come marching in, you were humming?
Yeah, it was. I'm sorry.
They'd come marching in.
It's what happens when you grow up in a Southern household. Okay, we think we're good to go. So Lamar, we're going to try again and let you start the meeting.
All right, I show 4:08 your time. I'm going to call this meeting to order of the Governing Board of East Valley Institute of Technology, number 401, and ask Dr. Wilson to lead us in the Pledge of Allegiance.
I pledge allegiance to the
flag
flag
of the United
the United States of America,
to the republic for which it stands,
which stands one nation, under God, indivisible, with liberty and justice for all.
Wow, that leads us to number 3, call to the public. Dr. Wilson, do we have anybody in this category?
No, sir, we do not.
And moving on to item number 4, reconsideration of the EVIT mask policy. I'm going to turn it over to Dr. Wilson.
Mr. President, members of the Governing Board, first I'd like to start off by just thanking you for taking the time to come together today. I know your schedules are busy and you have a life outside of EVIT, and so to carve out a bit of time today is very much appreciated. As you were aware, earlier this week, the governor lifted the mandate requiring all schools to have a policy and procedure in place to require face coverings or face shields or face masks while all individuals are on school campuses. The lifting of that requirement potentially has an impact on our reopening plan. As a reminder, even though the mandate was lifted, it doesn't preclude the governing board from still requiring or holding that expectation within our reopening plan. But if it's a desire by the governing board to change that plan, then that's a decision you have to make. It's not a decision I can make as the superintendent. So we're here today to have a discussion and possibly an action item to either keep the plan as is and require the face masks, or to modify it, adjust it, or to remove it. There's quite a bit of information that was sent to you today, and I'd like to share some of that again, just so that everybody has all the information in order to make an informed decision. One of the commitments I made to you several board meetings ago is that we would take the opportunity to reach out to the constituents we serve and gather their opinion on the face mask requirement. And so we took the opportunity to survey our students, our parents, and our staff. And for those who can see the slide, we asked a simple question: should the governor lift the mask mandate, should he keep it? And we see that when we had in the survey, we had over 1,000 parents respond to the survey. Of those responses, 34.24% of EVIT parents agreed or strongly agreed with keeping EVIT's mask mandate, even if it's lifted by the governor, while 61.46% of parents disagreed or strongly disagreed with keeping the mask mandate. We surveyed 992 students. Of that population, 39.62% of our students agreed or strongly agreed that EVIT's mask requirement should continue, while 54.53% disagreed or strongly disagreed. We surveyed 169 staff members. Out of that number, we had 43.19% of EVIT staff strongly agree that EVIT's mask requirement should stay in place, while 43.79% disagreed or strongly disagreed. I want to make sure that I'm acknowledging the hard work that our students, our staff, and our community has done this year. No matter what the decision is today, I am incredibly proud to be the superintendent of this organization, because I think we've done an amazing job providing the learning opportunities our students deserve. I also know that, unfortunately, no matter what decision the governing board makes, there will be a percentage that will disagree with it, and that's an unfortunate situation that you're in. There was also a question asked of me today that I responded to the entire governing board over. One question that was asked was, what are the CDC guidelines and the Maricopa County Health Guidelines? both the CDC guidelines and the Maricopa County Health Guidelines recommending masks at school. Another question was the lifting of the requirement of mandating masks violate our coverage from our our carrier. And as you saw, or as Kevin researched, it doesn't violate it, but it certainly makes the argument more plausible, but it doesn't violate it. Did I say that right? So, you know, the issue, I think, is a challenging one for the governing board to navigate, and I am sorry that you're in the position that you're in, but I do believe that the idea of making a decision and using all the data that you can possibly pull together makes sense. So with that, I will be happy to answer questions or let you all discuss.
I have a question.
And after Shelley, after Ms. Boggs, then I have a question as well.
Chad, just for full transparency, can you remind us and anybody who's watching the mitigation strategies we've been using, how much funding we used and where that funding came from?
Absolutely. So as a reminder, our reopening plan included a ton of different safety protocols designed to protect not only our students, but our staff. The safety protocols ranged from creating opportunities for social distancing, hiring additional staff that would help facilitate that social distancing, hiring additional staff to increase our sanitizing and cleaning procedures, hiring additional staff to wipe down high-touch areas throughout the day and to sanitize before school, in between AM and PM, and after PM. We also added health professionals on our campuses to be able to not only address students that might be feeling ill, but to do contact tracing. We created the opportunity to post our results weekly. Admittedly, we didn't the last 2 weeks, but we've updated those results so that parents and community members can track the amount of active cases on our campus. The whole amount of dollars that we spent creating the protocols was well over $1 million. And those monies came to us from the federal government as it relates to the COVID relief fund so that we could have the resources in order to do the additional costs necessary to create an opening plan that we felt gives us confidence that our students and staff can be here and be here safely. If you've tracked our cases, I don't think we've had a week in which between both of our campuses, we had more than 9 cases. And that wasn't that the 9 cases happened here. It was that there were 9 reported students or staff members that had the virus, but not that not that the virus is transmitted here. And so we're really proud of the work that we've done. And clearly, regardless of the decision the governing board makes tonight, those other mitigation and safety protocols will stay in place because we believe that those have allowed us to be as successful this year as we've been.
All right, thanks. That was great.
Thank you. Jeff Fleedham here. I've got a question, or actually a point. In our statistics here of the answers, it's not unusual to not consider the people that neither agree or disagree, that have no opinion whatsoever. However, if we look at that, requirements should continue even if the governor lists the mandate. If we include the neither agree or disagree, the numbers are actually 65.76% don't want the mask or don't care, and 34.24% want the mask. Those numbers are not, we're looking at 60-40 on the next one. And on the EVIT staff, we're looking at 56.81% to 43.19%. So those that have no opinion one way or another, you know, if we take those numbers out, you know, if those not so if 50% didn't care, then you know, we'd have 25% that care, then 25% that didn't care. But those that don't care are actually people that wouldn't care if we didn't require masks, or if we made a decision that masks were masks were optional. So provided that physical distancing and the other sanitation measures were in place.
I have a kind of a question. I don't know whether it's a question or a comment. If the board made the decision to drop wearing of the masks, could we also include a provision whereby students that wanted to continue wearing the masks do so? That's kind of the where.
Mr. President, yeah, Mr. President, members of the governing board, I would absolutely encourage that if the board's majority is to no longer require the masks, that there be a clear indication on the part of the board that those individuals, whether it's student or staff, that want to wear a mask should not only be encouraged, but should be supported. And I think
Yes.
that message needs to be made, because I think at the end of the day, we want to create an opportunity for all individuals to come back to school tomorrow feeling safe and comfortable. So absolutely, you can do that, and I would encourage you to do that.
And could we also continue with all of our protocols, the washing, the sanitizing, the everything that we do between sessions and after school's over as well?
Absolutely. Independent of the decision that's made today, we're going to continue those, because again, part of our safety protocol and part of what we believe has worked are those measures. And so we will continue those regardless of the decision that's made today.
Very well.
I have a couple of questions.
Thank you.
I have a couple of questions, Dr. Wilson. First one is, how much? Hmm? Oh, okay.
Mr. Chairman, Mr. Lane's asking for attention.
Okay.
My question is, first one is, how many more days of school do we have left?
Last count, we are at, I think today's 20 days. So it's either 20 or 19, depending on if you want to count today.
Okay. And the second one, my understanding, all the students and staff and other employees signed an agreement about wearing masks and so on and so forth. So it's implied that that is going forward. How much time would it take to redraft that and have everybody sign it and acknowledge it, that they're not wearing masks and whatever? Because I'm not sure if we just say today we're not going to wear masks anymore, that kind of leaves a lot of people under a false assumption that masks are being worn, and could cause someone to take a risk that they're not informed about adequately or willing to take.
So I'm going back in the archives of my brain, and I don't know, and correct me if I'm wrong, if we had individuals sign a consent to wear a mask. I think what we had is individuals sign a consent, a waiver, to acknowledging the inherent concern about being in person with COVID. I don't believe, and I could be wrong, correct me if I'm wrong, I don't believe it was stated in that wearing a mask was the expectation, and so therefore that was part of the signage. I do think that there was communication about the expectation, because that was part of the reopening plan that the governing board committed to. And so I don't know that there was a signed document that we asked individuals to adhere, to complete, versus a communication based on the decision that the governing board made in relationship to the reopening plan.
For 2 years, Dr. Wilson has always prefaced what he says with correcting me if I'm wrong. Finally, he's wrong. We had the students sign acknowledgement forms
that they were going to, otherwise
that had a student code of conduct which included wearing masks, and we made that part of policy JIC, which is student code of conduct. So the risk they acknowledged was based on the protocols that we have in place now, and if we remove that, it sort of undermines the value of the acknowledgement.
and it implies that something happens that's not, and unless we revoke that in writing and have every student or staff acknowledge it, by the time we got that done, school's out.
No, we could send a letter revoking it. We could do that right along with the motion, and I'd be happy to add that to my motion.
We could send that out in an email.
Correct.
I don't think that's rises to the level to indemnify you on that.
Kevin, can we send that out in an email?
Well, you're gonna have to get acknowledgements back that they've received
Right.
the email. The problem is that this is not necessarily a legal problem, but the problem is the students that committed to come here in the face of the pandemic were based on those protocols. So if you take those protocols away and the student no longer feels comfortable coming here, you might be depriving them of their last 3 weeks of education, which might be the most important 3 weeks.
We'll provide it online if we needed to.
Right.
Would we not?
We've already gone that ground, that doesn't work.
The problem, from my understanding, talking to the principals today, the last 3 weeks is more of the hands-on stuff, not stuff that you can really do online. That it's the culmination of their
But
training.
I'm just going to push back, nobody's saying they can't wear a mask.
Right.
That's
correct.
correct.
Just
Okay,
the freedom
fair
to
enough.
choose.
Fair enough.
Mr. Chairman? Mr. Chairman?
Yes.
So the question I have is, do we have any sense of how many immune-compromised students we have?
No. I mean, I know that we have some because I've had conversations with them and their parents, but that isn't part of what we're asking for when we enroll them, so we wouldn't have a definitive number.
For somebody who is immune-compromised, do they have any claim under the Rehab Act or the ADA or similar anti-discrimination statute for an appropriate accommodation for being immune-compromised? Do you know?
They might.
Would that accommodation mean that they not be put in a situation where their health might be damaged?
They would have to apply for accommodations through our accommodation policy.
If you knew that they were handicapped in that way, you have an obligation separately from their application to provide an accommodation. Am I correct?
Correct, but it would have to be a reasonable accommodation.
Understand.
And doing online, asking a teacher to do both live and online learning, I don't think at this point is reasonable accommodation, since we required all of our teachers to be here in person, that they can't do it remotely. I don't think that would be a reasonable accommodation. And I don't think that requiring, I have to think about this. The other solution would be just to keep the protocols in place, if that's sufficient to protect the person with a compromised immune system.
Well, that's what you've done. In fact, for the last year, what you've done is provided that everybody wear masks in the presence of immune-compromised persons.
Well, that wasn't the impetus for the policy. The impetus for the policy was the executive order that said you will do it.
I understand, but in fact, the accommodation is to protect them from the virus has been to provide that people who are in their presence wear masks, among other social distancing and the other stuff, hand washing.
Well, the effect of the protocols was to protect those people, but it wasn't as part of a Rehabilitation Act plan or a rehab plan or an IDA. I mean, it's just a coincidence that it also serves that purpose.
So as I read the materials, it looks like the CDC, neither the CDC nor the Maricopa County Department of Health have rescinded their suggestion that mask wearing be a part of the response to the pandemic.
That's correct.
Correct. So what changed the governor's mind? Any idea?
Election.
So was he relying on the CDC? Any sense of that?
Clearly not.
I would be over my skis if I tried to interpret the governor's decision for.
I know that the World Health Organization and the FDA also recommend mask wearing among those other protocols, the sanitation and distancing requirements. Are you aware of any other scientific authority that says it's a good idea for people in the tail end of the pandemic not to be wearing masks?
I am, if you would like me to share my list.
I would love to hear from you, Rhonda, and I would also like to know the percentage of kids, like what's the likelihood of them being the ones getting sick?
Well,
Couldn't hear what
science has
Rhonda said.
already, the science has already shown that children, I mean, we've known that since day one, that they are not at severe risk for the illness. There's
Right.
no There's no study that shows that they are. That's been since day one. That's
Okay.
been confirmed. Fauci's confirmed that. They should be in school. Fauci has said that. All of that's there. However, there's multiple scientific articles that have been published recently, including one by the CDC, talking about the transmission and masks not working for the spread of flu. There's one from the National Health Institute. There's one from I have my list here. I don't know where I put it. There's one from, I have like 20, so I could go here on all day. I mean, just so you know. So I did a lit review. I did a literature review of the latest documentation. And the reality is this. I've said this from this podium multiple times. If you ask me as a medical professional, do masks work? My answer is yes, if they're worn correctly. There is not one person in this room who's worn their mask correctly since I walked in here. Everybody has touched their mask. Everybody has taken off their mask. Everybody has moved around with their mask. The minute you touch your mask, you just ruin the whole point of wearing the mask. You're better off to wash your hands because with your 6 feet distancing, the 3 feet distancing, the touching is more of an issue as long as you're doing the social distancing. So if you're asking me, do masks work? Yes. N95's masks work. They have the right containment for the size of the particles that are spread with influenza. The rest of the masks, if you're doing your distancing, which we are already doing, you really, every time you touch it, you've just created a pathogen. You've just broke the whole reason you put the mask on your face. And I know that's difficult for people to hear, but you got to wear your mask properly. And everything in the CDC says appropriate mask wearing, appropriate protocol. Nowhere in the protocol does it mean to touch it and to take it on and off all day. It's not a thing.
Chance those kids are not touching it,
Nobody.
not moving it around, yeah.
Nowhere in the protocol does it mean to touch it and to take it on and off all day. It's not a thing.
Chance those kids are not touching it,
Nobody.
not moving it around, yeah.
Right. And that's why in the hospital setting, we put the mask on, we go in the patient room, we come out, we take it off, we put a new one on. Because every time you touch it, you've ruined your mask. So you either don't touch it or you touch it. And I'm sure Mr. Hart can back me up on this because he works out in the field too. It has to be appropriate mask use. And that's what we have not done a good job about educating our public on, is how to appropriately wear and use masks.
Too many people are taking the mask off, putting it back on, going out and doing something, taking it off, putting the mask back on. I see that all the time. I assume students
Everybody in this room has touched their mask.
Or taking it
No
off,
offense.
completely taking it
taking
off
it off.
and then put it, I've taken it off and put it back on. Same mask. And I assume students are no different.
Oh, students are much worse.
Mr. Hart would like to speak.
I'd just like to pose a question to Dr. Wilson, and I believe I know the answer, but I just want to confirm it. All the staff members at EVIT have been offered the opportunity to receive the vaccine on campus through Adelante. Is that correct?
Mr. Hart, so yes, short answer to that question is yes. Several opted to do through Mesa, the Mesa Bank, but whether it's through Adelante or through Mesa, they've all had the opportunity, yes.
Okay.
Mr. President, may I speak? Mr. Covington?
Absolutely.
Thank you. My son is an ER doctor, okay? And talked to him last week, and he says all the patients that are coming in are younger and younger and younger. I go by what he says because he sees it. He's in there every day with this pandemic. The other thing I'd like to point out is in the student section, person number 8. And this is good. Students will get comfortable if the requirements are too lenient, if we take them off. We have a very short time between now and the end of the year. I don't think this is time to change the program. You know, you've set up a real good program. It's really strong. It's really worked. I've talked with other people around, and they're amazed how well EVIT has done with it. I would hate to take it off for the last month, and all of a sudden something happened. I think that would be negligent. I think we should stay with the same program.
And I would like to say something. My
Speaking.
daughter and my sister are both respiratory therapists, work in the Banner hospitals, and they both, between them, there's 30 years experience, and all they do is breathing. That's all they work with, the lungs. They are experts in that. That's what this issue is with COVID, where people are dying. They said they have almost no patients with COVID in their hospitals, and with the ones that are in there are older. So I guess it just depends on which professional you talk to.
We could just
Everybody's
follow the
practicing.
research and look at the number of deaths in children. I mean, that's the reality. It's all published. And you can, it's there. It's not a kid issue. They're more at risk for suicide. We've had more suicide attempts, psychiatric emergencies, placements, and deaths, attempted suicides, than we have COVID deaths in teens and children.
This is Lamar Watkins. I seem to have remembered somewhere reading that children are the least likely of all the population to be spreading the disease. Is that correct? Is that the theory now?
Mr. President, members of the governing board, I want to walk a cautious line. My guess is that there can be research that validates and substantiates anybody's position, because
Yeah.
there's research out there that does that. And there's people on the board that are far smarter than I am, have far more medical experience than I do. So I don't pretend that I'm knowledgeable. But my guess is that this isn't a conversation that's going to be solved by citing research and medical exams, because there's going to be varying opinions. My opinion on it is, it really boils down to, my opinion, do we put weight in the survey results one way or another, or do we say it's 3 weeks of school left, finish the way we started? And that may seem overly simplistic, but I think really that's what it comes down to, because the debate on whether science proves it or doesn't prove it, or what's the medical professionals say, I think is going to be an argument that it will go circular and there's no real definitive answer to it. So, I'm not trying to minimize those conversations, but I do think at the end of the day, it comes down to, you guys have to make decisions, and you got to pull data from a lot of different sources, personal beliefs, structure of the school year, the time of the school year. But I also think the surveys matter too, one way or the other. And I think it's that combination that you all, in my opinion, come to a conclusion and make a decision individually, and then collectively, whatever that decision is as a board is what the organization does.
I agree.
In that frame, I'd like to make a motion, and my motion is going to be based on largely what the representatives in this have said, and that is, I would like to make a motion that we allow choice, the freedom of choice for all students and faculty on wearing masks.
I second that motion 100%.
I would like to see that amended slightly, to have it read that we would also continue with all protocols on the campus.
All
Yes.
other mitigation
Yes.
mitigation strategies, I will go
Yes.
ahead and amend that to say they have the freedom to choose to wear a mask, and we will continue with all other mitigation strategies. Do you want to
Ms.
second that, Ms. Boggs?
I will
Yes,
second that.
Okay.
Is there any
Mr. Sleeper?
discussion?
Discussion, I would like to ensure that that we state that physical distancing is still suggested also.
That's part of the
Absolutely.
mitigation strategies.
Well, that's part of what we do, but we encourage 6 feet physical distancing, not social distancing, by the way. It's physical distance.
I thought that was included
Not
in
about
her
social.
motion.
It is.
It is.
It is.
Okay.
Mr. Chairman, I oppose this motion. I'd like to point out that the 3-foot protocol between the students in the CDC's guidance here indicates that that only occurs when folks are appropriately masked. My colleague points out that all of us have been remiss in our mask wearing and management. And in fact, the Maricopa County, I think, makes a point that's quite consistent with what my colleague says. Schools should encourage modeling of correct and consistent mask use by school leaders, local leaders, and others respected in the community. The fact that many folks have not managed wearing masks appropriately, myself included, is no reason to throw that out entirely. Seems to me that given the amount of time left between now and the end of school, the appropriate thing to do is to continue the protocol as it was put forward at the start of the year to the end of the year, at the conclusion of which, we are in a new year. We can make some judgment about whether it's appropriate or not to discontinue masks at that point. But this is a fight we don't really need to have given the short timeline that's left. And so I'm going to oppose this motion. I intend to offer, I think this motion deserves to have a fair vote. I intend to offer a motion to continue the protocol as it exists till the end of school. If the motion put forward is not successful.
And you have that right.
Absolutely.
Is there any other discussion? We have a motion and a second, so I'm going to call for the vote, or ask Ms. Boggs to call for the vote.
Okay. Watkins,
Aye.
Doolin,
Aye.
Boggs is an aye. Fleedem? Fleedem?
We can't hear you.
Nay.
Hobson?
No.
Hart?
Aye.
Covington?
No.
Lane?
No.
Johnson?
Aye.
What was that?
Aye.
5 ayes, 5 yeas.
Motion carries.
Motion carries.
That brings us to item number 5, adjournment.
Also move?
I have a second.
Second.
All in favor,
Second.
say aye.
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 Aye. Opposed? Meeting adjourned.
Thank you again for your time.
Thank you.